Hey guys, thanks so much for coming over. Pizza's on its way, but I brought some candy just for you guys to snack on in the meantime.
Thank you.
Thank you so much.
Yeah, it was a rough day at work, right?
Yeah, totally. Signs are so annoying. Are you okay? Are you okay? It looks as though he may have airway obstruction, which is blockage to any part of the airway. This obstruction can partially or completely prevent air from getting into your lungs.
Airway obstruction can turn life-threatening. This condition may require hospitalization. About 10 to 20% of ingested foreign objects require non-surgical intervention, which approximately 1% require surgery.
Which is why it is important to understand the different types of an obstructed airway, their signs and symptoms, and what we could do to help in the prevention or treatment of these kind of emergencies.
The most common item involved in airway obstruction or aspiration is food, but that's not the only thing that can cause an airway obstruction. Other causes could be a foreign object being lodged in the throat, allergic reactions, and viral infections.
Other causes could be respiratory illnesses like asthma, swelling of the tongue or epiglottis, and abscesses in the throat or tonsils.
There are also different kinds of airway obstructions. There is partially obstructed airways, completely obstructed airways, aspirated foreign object, and ingested foreign body, which all have similar yet different signs and symptoms.
Based on our situation, we have found that our friend is suffering from complete obstructed airway.
My signs and symptoms include respiratory distress. You'll also see that I place my hands around my throat area. Cyanosis, which means that I would turn the color blue, and I would be unable to talk or cough and eventually lose consciousness.
Some ways we could help prevent or treat complete airway obstruction would be to first sit the patient upright and encourage them to keep coughing to remove the object.
If the patient stops talking and does not speak, abdominal thrusts such as the Heimlich maneuver should be performed.
This should be continued until the object is expelled or patient loses consciousness. Proceed to lay the person down, open airway, and attempt to ventilate the patient.
If breath enters the lungs, continue with the circulation, airway, and breathing. If breath does not enter the lungs, CPR should be performed and proceed to contact emergency medical services.
And remember to sit the person upright and have them keep coughing. Keep coughing.
Next, we're going to proceed with the Heimlich maneuver. We're going to start with the fist, over to his belly button, and squeeze.
Proceed to lay the person down and open airway. Attempt to ventilate the patient.
And proceed to call emergency medical services.
References.